What's up, guys? This is Dr. Kyle from Cape Chiropractic and Acupuncture coming at you with this week's movement tip of the weekend, casual Sunday. But today we're going to talk about two things that are related to anterior shoulder pain, which we've been seeing a lot of in the clinic. And I wanted to address anterior tilt of the scapula or your shoulder blade, as well as anterior humeral glide, which is your actual upper arm translating forward in your shoulder socket, essentially. So I like to use the analogy of a golf ball and a golf tee. A lot of manual therapists and rehabilitative specialists like to use this analogy of, think of your arm here and going into your shoulder socket as a golf ball and a golf tee like this. And what I'm talking about with this anterior humeral, which is the arm glide, is when the ball and socket joint actually drifts forward. So when your arm drifts forward into your shoulder, that can set you up for a host of irritated tissues, especially one in the front here called the biceps tendon, which gets really cranky if you bring your arm up overhead or if you're reaching for things. Also, it sets you up to have some impingement or some discomfort in the top of your shoulder. So these imbalances are frequently seen, especially in the gym, but also with people who tend to work at desks. I know in the past we've talked about the kyphotic posture or rounding of your upper back and how tissues in the front get tight here. But a lot of the time when people go to exercise or go to the gym, they have the best effort or the best intention to help kind of undo the damage from working or whatever it may be that they have to do. But I just want to make sure that some of these movements that we're doing in the gym are being performed to the best of their ability or your ability, so that you're reducing the likelihood of having these irritated tissues. So some of these common movements where you can have this anterior humeral glide or this forward translation of the humerus and anterior tilt of your scapula is things like push-ups, things like pull-ups. So if you're going into a pull-up and you're pulling too far, you see how my shoulder goes forward here like that? It can put some stress on the tissues. Another example is when you're doing a push-up, some people tend to wing their arms out and really put a lot of tilt into the front of the shoulder. So instead of really giving any sort of stretch this week or any sort of rolling or anything like that, the major goal is for you guys to be aware of the fact of your shoulder position when you're doing things like pull-ups, when you're doing things like dips, right? All these motions that create this anterior translation and anterior tilt of the scapula. One thing to be cognizant of when you're doing these movements is to try to think about, it's a really, really touchy subject, but a very, very helpful cue for a lot of people is think about not necessarily pinching your shoulder blades together this way, as much as trying to tuck your shoulder blade into your back pocket as you're doing a lot of these movements. So when I'm doing a push-up, I like to just start by tucking my shoulder blades in my back pocket, keeping my elbows nice and tight, and keep your elbows between about 30 to 45 degrees instead of winging out like this, because that puts that shoulder in a very anteriorly translated position. So tuck those shoulder blades just a bit, come down, and notice how my shoulder does not rotate forward as much. So keep that in mind, and you will reap the benefits. Try to keep the shoulder in a nice stable position, don't let it drift forward, and there will be no anterior shoulder pain. Thanks, guys, have a good week.